All right.
Hi. Ready? All right. Thank you, everyone, for coming to the South Texas Regional Family Medicine Grand Rounds. Our educational partner today is the South Central Area Health Education Center, and our department's mission statement is inventing a healthier future for families and communities in San Antonio, South Texas, and beyond through excellence in patient-centered care, research, and education. Thank you in advance for our virtual viewers muting your microphone once the presentation begins, being attentive to the presenter and engaged in the session, keeping cameras on when appropriate, registering for CME credit for each session, and completing and submitting a session evaluation form at the end. Today is November 29th, 2023, and our activity code today is 1009-3225. To claim the CME credit via text your email address to the toll-free number, and then text attend 1009-3225. I'll leave this up here for a minute. You must register by midnight to receive credit. All right, and this is just a little bit of the new CME system. Send a text to that number on the screen with your email address connected to your existing CME profile. It will connect your responses. So for today, again, the activity code is 1009-3225. All right, if you need to access your CME transcripts from the Long School of Medicine CME website, visit their website at cme.utesca.edu and follow the instructions on the screen. You can also use your AAFP login to claim credit for this activity at the link on the screen. This live activity, South Texas Regional Family Medicine Grand Rounds, has been reviewed and is acceptable for up to 1 prescribed credit by the AAFP, and physicians should claim only the credit commensurate with the extent of their participation in the activity. The Family and Community Medicine Grand Rounds address the following nationally established physician core competencies: the Institute of Medicine core competencies, the ABMS, ACGME competencies, and the AAMC competencies. Our speaker today, Thomas Matthews, MD, has no financial relationships with ineligible companies to disclose. And now our program director, Dr. Data, will introduce.
Thank you very much. I'd like to introduce our speaker for today, Dr. Thomas Matthews. His topic is going to be CPAN and PeriPAN at the University of Texas Health Science Center, San Antonio. Dr. Matthews is a professor clinical in child, adolescent, and adult psychiatry at UT Health San Antonio and the Clarity Child Guidance Center. Dr. Matthews has been in practice since 2002. Dr. Matthews specializes in treatment of ADHD, anxiety, depression, and mood disorders. Dr. Matthews works in outpatient, inpatient, and partial hospitalization settings. Dr. Matthews, I'll turn it over to you.
Well, thank y'all for having us. And I also want to make sure, I'm also fairly laid back too. So if we have questions as we go, please just raise your hand and ask, and we'll kind of address things. This will be a fairly informative thing, hopefully about just some options and resources. And I got a couple examples of patients that we'll kind of go over. First, Catherine Silva over here, she's our representative for you guys. She's our liaison for CPAN. And then Millie Gaspard, who's over there, they're the ones who also bring you this really cool stuff. So to start off, when we were talking about, thank you for the introduction, but it was also, I was thinking about it. So I started here in 1993 is when I started medical school, and I realized I'm 22 and a half years as faculty, and every time I think of that, it just makes me feel really old. I mean, right? It's just, we've both been here for a very long time. Yeah, I know. So I've kind of had a fun journey here. I've kind of done various different things throughout my career. I was training director for our fellowship program. For about 10 years, I was in the dean's office as dean of student affairs. And then now I've gone back just to sort of clinical and our division chief. So I want to tell you a little bit about our division, about child psychiatry, so y'all can be aware of sort of where we are, where we come from. So for our psychiatry department, we just built a new building. If any of y'all remember the old VA building off of Eckert, so that has been turned into a new behavioral health and wellness center. So our entire psychiatry department has moved over to that building, except child psychiatry. We're very happy about that. We're based over at Clarity Child Guidance Center. So if you don't know much about Clarity, Clarity is a 66-bed inpatient child psych hospital with about a 40 to 45 day hospital, partial hospital program that we have. And then the first floor of the outpatient building over there is where we have our whole child psychiatry division. All my faculty are there. All of my fellows are there. We have a fellowship. Their child psychiatry is an interesting thing, is that instead of doing your 4 years of adult and then going to a fellowship like most normal fellowships do, is that you're able to substitute your first year of child as your last year of adult. So it's a 3 year of adult, then you do a 2 year child fellowship. So they're PGY 4s and 5s. We used to have, about 3 years ago, we had 3 first years, 3 second years. We now have 6 first years and 6 second years. And we were able to double the program. And I'm sort of giving you all this backstory so that when we get to the consortium stuff that we're going to talk about, you're going to understand how this happened. Because I think in the past 3 years, what has happened with Texas and this Texas Mental Health Consortium is the best thing for child psychiatry that I've seen in my career. A lot of my people who are even mentors of mine said the best thing that's ever happened in like 40 years for children's mental health. So that's what we're going to get into, so we can give y'all kind of a little bit of history on that. Okay, so let me get my slides moving. Okay, I think I went the wrong direction. Yeah, and that's my only disclosure, is that I am a state of Texas. I work for the state of Texas forever. I will probably die here as an employee of the state of Texas. We will see. Okay, so part of the things that, if you look here, there's a lot of gaps. I'm not telling you all stuff that you don't already know, but gaps that's in mental health care, right? There's people in need, they wait forever. If you actually call up right now sometimes to see a child psychiatrist, even adult psychiatrist, sometimes it can be 6 months. It can be, we try to keep ours no more than like 2 to 3 months to try to get kids in. But even with adults, it can be really, really hard. So we've got a lot of programs we're working on in our department for adult psychiatry and child psychiatry to help with this. One of the things that's not part of the consortium I'm going to talk about, but to let y'all know about, we have a couple adult clinics. One is called the TCC. That's a transitional care center. And that's actually a clinic where if somebody has been hospitalized psychiatrically and they don't have an outpatient provider, they can go over there and they try to do about a 6-month transition where the psychiatrists there take care of these acutely sick patients before they transition them off to somewhere else. We also have something called the Now Clinic, and I cannot remember what it stands for. Do you remember, Catherine? I know. So our Now Clinic, what it is, it's the same thing as the TCC, but you don't have to have been in the hospital. Okay. So it's basically, if you have somebody that you're like, this person needs to get seen, they can get in the Now Clinic really quick, and somebody will take care of them for about a 6 month. And then they try to while they're working on the transition to get them out. So it's sort of more of a more rapid access, which psychiatry for pretty much forever has not had, except for psych emergency rooms. And that's not a very efficient way to do things. So We have those programs even with adult psychiatry. But with child stuff, when you look at this, it takes forever to get in. There's some of that stigma that we still get a lot. Where patients don't want to come in, or even they come in. A lot of kids I get in the hospital where the parents are like, I've heard bad things about psychiatry. I don't want you to poison my kids. And so we've actually made it part of our vernacular that we actually, my sort of little, I don't want to say song and dance, but when I have a family that comes in, I'm reading the family and I'm watching their eyes, and I have to do the explanation about here's why we do what we do. And here's the importance of this. This is, and just so y'all are aware too, is that what my fellows, at least if any of them tell you different than this, I'll get after them. But I tell them all is that meds are never the answer. Meds should be our last resort. Okay. So much of what we want to do is we want to get people in therapy. We use meds when we really need to. And so you'll see as we go through some of these cases, and we'll talk about, you kind of understand some of that. That's our philosophy is we need to help try to fix the system. We need to help a lot of different things. But we also got to figure out where people are, because sometimes if I can get somebody who's at a 8 out of 10 anxiety or depression, and I can get them down to a 3 with a med, boy, it makes it a whole lot easier for the therapist or everybody else to then kind of get them down to a 1 or a 0. Okay. So with that, we also have mental health care, expensive, sometimes covered, sometimes not covered. It's been a very interesting thing. I don't know if y'all saw, if you have some of your adult or child patients that if you refer out, insurance is giving a lot of paperwork for psychiatry, and which it does right for everybody. So what happened is psychiatry is one of those where they can just go set up shop, and so there's a lot of people in private practice who just basically go and say, you're going to pay me, you give me cash. Okay. I'll take care of your kid. I will give you the receipt and you could submit it to your insurance. So opposed to, the physician then gets the full price as opposed to whatever the reimbursement from the insurance company. So we've been seeing that a lot more in mental health. And the hard part with that is then only the people who have the financial well-being to do that can see certain people that are in the community. So it's made it a little bit harder to get access to care. My clinic over at Clarity, we have, I want to say we have about 3,000 patients on our caseload over there. We are a 55% Medicaid clinic, and we're one of those where we're like, if you can't pay, we're going to figure something out. We have something called Clarity Care that can help out, stuff like that. So we're one of the few that I think still does that volume for child psychiatry of Medicaid. And the other thing is this part is you see that frontline clinicians, which are y'all and pediatricians. I'm married to a pediatrician, and my wife's faculty here too. So we actually get a lot of these conversations that sometimes they're like she's a training director. And so some of her residents are like, I don't know what I'm doing. And so my wife will tell them, well, call CPAN. This is what we're going to talk to you guys about. But a lot of times y'all don't have the training that we have. So what we're hoping is that this system that I'm going to show you is something that we are here for you. If you guys need us, we're here to help out. Okay. The Mental Health Consortium, as you see here, like I said, it was a couple of years ago. It was the 86th Texas legislature. They actually were trying to do the consortium to make it for adults and children, that they were going to get funds for mental health for adults and children. And there was actually one of the senators who is not very pro mental health who crushed the bill. And so we then got ours tagged on to a school. It was a school-based one about sort of giving support to kids in the school. So they actually slid our Texas Child Consortium onto that one. So instead of being the Texas Consortium, which was going to give money for adult mental health, we now only have the child part. I wish someday, hopefully, that they will do the adult part, but that's where we got this. And so, like I said, this is probably one of the best things that has happened to children mental health, because they did, I want to say it's $130 million. And they basically are dividing that among all the schools across Texas. And so we all have different areas and regions that we cover. So if you look here, where all the different ones are, each of these are the different parts of Texas is broken up. They're managed by a medical school. Okay. So you can imagine the dark green up top. Okay. So you're looking at, that's going to be Texas Tech is going to be managing up there. You're going to see where we are around the Bexar County. The Dell has theirs. You have UTRGV is the red at the bottom. El Paso over there, so Southwestern. So each of the different schools has their system. The nice thing about when we go into kind of the details of the consortium, if you want to call CPAN, you need resources for a kid or whatever, you call one number. Anybody in the state calls one number, and everybody has the same one. You call it. The difference is, I want to ask you about the next thing. It's going to be what region are you in, and then it'll narrow you down to that region. And so for us, when you come down, you dial 3, and then you see we're number 2 right there. You get one of us who's here. If something happens and we're in a meeting and we're not able to be there, one of my docs is not able to be there, then it will route to one of the other areas, and they may not be as familiar with here, but they can answer your question. When I talk about PeriPAN in a minute, we'll talk about that because that's a growing thing right now that we don't do as much with. But so this is kind of how we move that part. So the top two are the ones that we're going to talk about more in depth. So I just want to give you a little brief blurb on the three bottom ones. When the Texas Children's Health Medical Consortium came out, they had sort of 5 arms to this. The first is CPAN, which is Child Psychiatry Access Network. Second is TCHAT, Texas Child Health Access Through Telemedicine. That's our school-based program. And then the research initiatives, we're actually, we have a lot of people who are doing research on depression and suicide, various things. And a lot of them are mainly in our clinics. We have a PTSD research project going on, a whole bunch of different things that we're using to kind of do research because the state was like, hey, it's not just about treating the people. We got to figure out how we can do stuff to prevent for the future. So hopefully we'll be getting some good info and data from that. CPWE is the other one, the Community Psychiatry Workforce Expansion. What they did with that is that was to look at the mental health authority. So every county has a mental health authority. We have CHCS, which is ours, the Center for Healthcare Services. They're the Bexar County Mental Health Authority. And so within each of those, they are tasked for taking care of mental health needs of people in that county, funded or unfunded. So CHS is our main one. So what this allowed us to say we can get more bodies and more people out to give care to those places. So we were able to create a clinic over at the Center for Healthcare Services where we have 2 of the fellows are out there full time and faculty go out there. The other stuff we do with that, we actually cover Gulf Bend, which is in Victoria, Texas. We do telemedicine. And I think I have 3 fellows who do 3 half days each of telemedicine to Victoria and Gulf Bend. And then we also do Hill Country, and Hill Country covers multiple different ones. So Hill Country covers like Uvalde, Kerrville, Canyon Lake, New Braunfels, a bunch of different areas. And so I have another 9 half days. So 3 fellows doing 3 half days each that they do telepsychiatry for children's mental health for those things. So that's how we were able to expand and reach a lot of the kids who weren't able to access this care elsewhere. Because I used to have people who would drive 4 hours, to come up to San Antonio to see us. This is one of the only benefits that I see of the pandemic is that for us in mental health, it really opened a lot of things. We can do so much telehealth, and it has been much better access to care for so many of these kids. I still love having people in person. That's just me being old, but the telehealth really helps out a lot. The last one, which is the CAP one that you see there, that's what allowed me to
Yes, I think so. We'll catch it up.
Okay. So then CPAN, this was
Pediatric health clinicians throughout Texas say that using CPAN helped them be a better doctor. CPAN is the Child Psychiatry Access Network, and CPAN is here to support you in caring for your patient's mental health at no cost. CPAN is a state-funded service that provides real-time, peer-to-peer psychiatric support, and consultations may be billable. CPAN also offers vetted, personalized referrals within 1 business day, so you can get your patients the help they need quickly and with confidence. CPAN knows that developing a procedural memory for something as complex as mental health care requires support, and we're here to offer that support to pediatric health clinicians. Thousands of Texas pediatric health clinicians are using CPAN. You can join CPAN in about 10 minutes and get the answers you need to help your patients with their mental health concerns.
A rural Medicaid patient of mine had an eating disorder and she needed a counselor. I used to give my patients a resource and referral list that wasn't vetted. It was time-consuming and hard for parents. Recently, I had my nurse call CPAN. By the end of the next business day, I had a specific list tailored to my patient's needs and insurance, which I could share with their family. Enrolling in CPAN today gets you immediate access to referral support and peer-to-peer psychiatric consultations.
You can ask CPAN to find patient referrals for you. With single business day, local resource vetting, CPAN keeps work off of your staff's plate to ensure your office stays as productive as always.
Referring my patient to an anxiety and depression specialist would have taken months. But she didn't have to wait because I called CPAN, and I collaborated with a psychiatrist on a treatment plan, and she answered all my questions. It was a Friday afternoon, and they called me back within 30 minutes. With CPAN's guidance, I was able to help my patient that day. I have more confidence because I know I can contact them as many times as needed, even for the same patient, and get step-by-step guidance.
You're welcome. When you call CPAN, you're talking to board-certified psychiatrists, mental health experts, and clinicians. We offer peer-to-peer, timely, evidence-based mental health guidance. Together, we can provide the best mental health care to children under one roof. We're here to help make sure you're supported for any mental health issues your patients face, to give you the support you need and the confidence you need with this patient to be ready for the next one. You maintain the provider relationship, and we will give you the support to do it.
When I was in my residency, I didn't have extensive training for treating ADHD, anxiety, and depression. If it were pulmonary distress or diabetes, I've seen it, done it, and taught it. CPAN has really helped me get comfortable with providing evidence-informed, family-centric solutions regarding the mental health of my patients.
CPAN also offers free training to give you the skills you need to build your expertise. CPAN offers free CMEs and Project Echo case study learning on a wide variety of mental health topics, such as autism, ADHD, trauma, and suicidality. CPAN is here to help. Enroll today and join the thousands of Texas pediatric clinicians in caring for the mental health of our children. Thousands of children and families have been helped through CPAN. Let us support you to take care of even more Texas kids. Enrollment only takes 10 minutes. Hope to hear from you today.
All right, let's see. Can I move on? Nope. Not yet. All right, there we go. Cool. Okay, so now I'm going to go a little more in depth about this, and then I'll tell you a couple, like some of the stuff that we called for. So CPAN and PeriPAN, there's 2 different things. I'll flip to the next slide in a minute. It's basically, you know, like she said, you get the learning board certified psychiatrist, you get learning opportunities and stuff like that. The thing with us is all of us who are doing it, the CPAN, we're all faculty here and we all love to teach. So I need y'all to know that if you ever call me and I start explaining something and you're like, I'm in clinic, I got to go really quick, I don't get offended at all, but I want to like teach as much as you want to learn about this. Because the thing is y'all are the front line. I mean, y'all and pediatricians, when it comes to children's mental health, they go to you. I remember, 20 some years ago when I was in training, 25 years ago, if you would get a lot of these straight ADHDs or straight things coming in, I don't get any of that straight. We've become so much of a specialist. Y'all are the front line treating all the stuff that I used to treat 25 years ago. And now I'm having to take care of all the stuff that's the multiple illnesses, multiple medications and stuff like that. And even bad stuff. One of my stories that it's just, you know, I cringe when I say this. I had a kid that came in the hospital the other day. He was 7 years old and on 7 medications, psychiatric medications. Okay. He was on lithium. And I don't know if you remember the levels of lithium, should be a 0.8 to 1.2. They had him diagnosed as schizoaffective. The kid was ADHD and autistic, very different. He was a 1.9 on his lithium. So you had lithium toxicity. He was on 7 different medications. And that's one of those where I just cringe and I'm like, that's bad medicine, right? So a lot of times what we're doing now as child psychiatrists is cleaning up stuff that are other people have done, you know. And so we become the specialists. So like I said, you guys are the front line. So that's where this service should hopefully be very helpful, is that what it is, if you're going to call, like it says, it takes 10 minutes to register. There's 2 registration parts, and she's going to correct me if I get this wrong. One, the clinic has to be registered, which y'all's clinic is already registered here. And then the second is that we get the physician registered. So what that is so that's where you can kind of get information if we need you for, like, we can send you the stuff on the CMEs, we can send you all their stuff. Once you get signed up that first time, after that is the standard that we have is that if you guys call and you're like, I need to talk to a psychiatrist about a kid, you have to have one of us on the phone within 10 minutes. I think our standard right now is we're at 3.5 minutes.
Really quick.
Yeah, like really, really fast. And so I'm telling you guys this, but I think more importantly, even than y'all, is that you got to let your staff know about this, because what happens is I would say, I think it's only 40% of all the calls that come into CPAN are for one of y'all to want to talk to the psychiatrist. A lot of times it's your staff. Your staff calls and says, like they said in there, I got a kid. What are the eating disorder places in town? We'll be like, go to Esperanza or go to the Eating Recovery Center, right? And so we have places that we can tell you about. And towards the end, I'll tell you about a couple other clinics that we have that you can call CPAN, and like one's a trauma one, and we have a couple different ARPA ones that I'll show you about. But this is one of those where if you're like, I've got this kid, I don't know what to do with this kid, call us and ask. It doesn't have to be you guys. I don't want y'all sitting on the phone waiting. Get one of your staff to call. And then sometimes then you'll have to jump on. And then if you get me on the phone within a couple minutes, I'll be like, what do you got? What's going on? Because you give the information to the staff and then they tell me, so that I hop on and say, oh, it sounds like you got a 4-year-old there, you know, fill me in on whatever other stuff you're seeing. So you get us really quickly. And then we try to sort of explain what's going on. And it will hopefully make a little more sense in a minute when I talk about the some of the cases. Now, the PeriPAN is new. So we're not doing PeriPAN here in San Antonio yet. If you were to call about the PeriPAN, that would probably go off to either to Dell, Baylor, one of the other places. We're working on trying to get that going right now. We have one of our faculty, Abby Talley, who's here. And Abby, one of her main, she's a child psychiatrist, but half her time is spent doing maternal fetal medicine or maternal fetal mental health. So she's wonderful. We're trying to get this up and going for us. This is for y'all if y'all have any of your pregnant patients or any of your postpartum patients. That's what this service is for. The CPAN is for child psychiatry. The PeriPAN, you call and they'll route you to the right place. And that's one of those where you're like, she's depressed, she's suicidal, she's in her 3rd trimester. Should she be on meds? Should she not be on meds? You know, or even if it's the 2nd trimester, what's the risk benefit? You can call and you can get somebody who can say, hey, let me go over this with you so you know what to do. And then Dr. Talley sees a lot of her peripartum and postpartum patients over at Clarity Child Guidance Center with us. So we have her housed over there. So that's what the PeriPAN is for. So that's one that if you get a pregnant patient on psych meds, when in doubt, even if you want to call and then you could just document in the chart, I called them and talked to them. Okay. The other thing to add on to this is that we have the professional education. We do a CME thing. I think, let me see if that's it's not the next slide. Well, let me do this part first, and then I'll go tell you about the CME stuff. So this part, the other thing is that, you know, how when you're doing your billing and coding, do y'all do a lot of your own billing and coding? I guess everybody kind of, okay. That's what I try to make sure that all of my like residents and fellows, and then even like all of our faculty, we have to all keep learning because it keeps changing so much with us. This is a completely free service. We're getting paid by the state of Texas to do this for y'all. Okay. So even when I mentioned about us doing the telepsychiatry or us going to CHCS, when I have my fellows going out there, that site is not having to pay for us. This is, you have a free body who then you can bill for. So you're not paying for the person, but you're getting the revenue coming back. Right. So that was one of the neat things about doing this is, so for y'all, if you call on the same day of the patient and you call and you're like, I got this kid I saw this morning, but you know, you only have time at like 12:30 or 1 or whatever. You call us and you say, hey, I've got this kid, You can increase your level of complexity because you can say, I talked to an external source. And so you can code higher in your billing. We are not billing for it. So there's going to be no conflict in what's happening. It's completely free service to y'all. So you can actually do that increased level of complexity. So that's a very nice add-on that you can do if you call us. And that's something I think sometimes people forget, that I always want to say, don't forget that, because you're just leaving money on the table. I mean, not that it's about the money, but you know, those of us that are academics, right? We know that. Yeah, exactly. It's not about the money, but you're right. We still got to balance. So we still got to balance. So that's something that don't forget about that. Now, this part here this is a CME portion, and the picture you probably can't see very. Who do we have on there? Oh, that's different than the one that we had. Oh no, over here. This is the one I'm looking at over here. So I don't know if y'all know Tracy Schulstrom. Tracy's been a faculty. We joke that she's my work wife. She is her husband is our training director for general psychiatry, and Tracy is just one of the best docs I've ever met in my life. She's wonderful, and she just did a talk yesterday on psychosis. So it was one of those about psychosis in teenagers and kids and teenagers. And so when we do these CME things, if y'all have time, they're always from noon to 1. So it's during lunch. If you're like, wow, that sounds interesting, you hop on. It's usually a 30-minute presentation that one of us will do. And then we'll be like, question and answer. Do you have a question? What do you want to do? And stuff like that. We do them on eating disorders. We do psychosis. We kind of change it up a little bit. We do ADHD. I think I did a school refusal one. I kind of do a general one. So we have lots of these that occur about once a month. You can kind of jump on these if you ever want to get the CME credit, just extra CME. So anything else with this one, or can I move on?
Yeah, we host echoes twice a year. So once in the spring, once in the fall. So our next echo series will be coming up April. So if you're registered or if you want to scan that QR code, we can send you the information.
And the echo is the trauma-informed care, which is kind of a big thing that's coming out right now. So that's only the one we do twice a year. That's a really good one to if you want to do sort of trauma-informed care, figure out how to bring that into your clinic. Okay, so I went the wrong direction.
Where you go, and that is, so this is live CME that's online, is that right?
Correct.
Is there an enduring aspect of it?
Enduring how?
But so do you want to?
This is they are recorded, and I don't think what we're working on, we're trying to get a platform set up where, yes, somebody can go in and watch it later. But if you see one that you really like and you want to find a way for us to get it later, we can get you access to it. That's not a problem. And all the CME is through UT. So I think it goes on to that same transcript that you guys have, that you do for this grand rounds. It would pull up on that, which makes it nice. Okay, so this is just, I was going to show you about our doctors here. One of the nice things is I said this to the oh my gosh, why am I blanking on his name? The vice chancellor at UT System, who was just here last week. He gave us our grand rounds last week. I don't know, I'm blanking on his name, but he was here. He was here last week, and he was talking about all the different programs across the state. And I bragged about ours because some of the other CPAN locations across the state, they may hire somebody to come in and do CPAN, and maybe somebody who's 1 to 2 years out of training. Okay, which is great, and I think that's a wonderful thing. But my bias is this: I made it so CPAN is one of our things that I have my senior people doing this, because you're going to have the ones who've been teaching for forever. We've been doing this for a long time. So I think between all of us that are right there that do CPAN, I want to say there's 130 years of practice that what we've had. And so we're all very different, but you sort of get the same quality kind of care with each of us that's there. We all really like it. It's 8 to 5, Monday through Friday. Sorry if you want to call me on a Saturday, I'm not going to do it. But if it's an emergency, we have ways that we can help y'all figure stuff out. But you basically call CPAN and you're going to get one of us. And we each do half days that we're doing this, where we're kind of helping with the consortium. So that's our group, and we're like it says, call as often as you like. It's fun where I'll get somebody who will call me and they'll be like, hey, you remember we just talked last week? And I'm like, yeah, of course I remember. And when we go through it. So for us, we also enjoy it because it's a lot of fun, because we know that we can't be everywhere. We're trying to just help you guys kind of understand some of the stuff that's going on with that. Okay. There's just one more slide y'all can look at later. Y'all get all the stuff. You can add it to your contacts, stuff like that. And then we're going to do 1 or 2 more things here. And then I'll tell you a couple of cases, and then we'll kind of quickly do T-chat. We have, oh, yes.
we're kind of just PeriPAN work after we've seen the kid, building the kid.
Call. This is a hell, when in doubt, you call. And if you don't know how to get directed or what you need, we will help you figure that out. We have like our two main people who do answer our calls is Shannon and Torgier. They're phenomenal. All right. They're wonderful. You call us and we will help. You don't need to make that decision. Yes. So the texting is, we rolled it out. It's just sort of barely rolling out for us because the texting is sort of a new thing. It's really quick. Like with Shannon and Torgier. So there are people that when you call, they're the first contacted. So if it's like, I need a resource, they can usually get that stuff with you and get it back to you really quick. Sometimes even if it's a text where they're like, hey, I need to talk to the doctor, then they will get one of us pretty quick on the phone. So it should be, it's going to be held to that 10-minute thing also. So that's, those are our metrics that the state are keeping us at.
All and we're not registered.
Yeah, super quick.
So we prefer you can set up a time or ask for us to reach out to you. We prefer to do it, either do it through email or phone call, just so we can gather the information. But we do ask, usually through text to set up a time to consult or to request resources, and then we'll reach out to you whenever it's most convenient.
So first time, like if you're first time call, it's gonna make it much easier. Just call the first time when you have a minute. After that, you do the text.
And we'll send around a paper for anyone who wants to enroll to help out with that.
And so we've only had this open for a couple of years, but this just shows you right there. We've got 11,500 enrolled. This is across the state of Texas, all those clinics, a lot of consults, and it's just growing and growing and growing. And you got to remember also with this too, we started this during COVID. So we have seen actually a huge uptick in the past 6 months to a year. It's really, really gone up. Okay. And so then, I think this is all stuff that I've already sort of said. Yeah, that's stuff I already said. We're going to skip that one. So I'm just going to put to this one where you can see. This is CPAN and it tells you about all the different things. If you're like, hey, do you have educational resources, maybe something on ADHD that I can give to a family? You call CPAN, right? If you're like, I need to talk to a psychiatrist, you call CPAN. We have these one-time direct consults, which I'll go over in a minute. You need care coordination. If you just want, the CMEs, any of that stuff that you need, you call and they'll direct you to the right place. So an example for you guys of some of the calls that I get as the psychiatrist part, like I said, 60 probably +% of these calls don't even come to me. I don't even hear about it because Shannon and Torgier are working their magic. They're making all this stuff happen. And so they're sending y'all resources, and the resources, if they need to send you something, usually gets back to you within a day. Like they will email it back to you within 24 hours. Okay. And they're like just really good about it. When the calls come to me, some of the calls I get, we have this thing, which is a one-time consultation that sometimes we will offer for people like, more often than not, like some of the calls, one of the ones here that I'll tell you, like I've got a handful of them, we'll see how many we can kind of get through. I had this nurse practitioner called me about, I guess 2 weeks ago. She had a 4-year-old kid who's basically aggressive and very impulsive, running out of the daycare, has gotten kicked out of 4 different daycares. And she's like, I don't know what to do. And so when she gets on the phone, I was like, okay, well, tell me what's going on. She's like, well, he may be autistic. I think he's autistic. She's like, I just need to know what to do. She's like, I want to get him a psychiatry eventually for long-term. And I said, great. So we started talking about the impulsivity. And I was like, is he an impulsive kid who reacts angrily? And if so, maybe this is an ADHD. And if we treat the ADHD, the anger is going to go away. I said, or because you mentioned that there's the autism and the ADHD, is this a kid who maybe there's sort of 2 parallel trains, right? We have the ADHD going, and then we have also this aggression and anger from the autism. She's like, that's it. That's what it is. I said, what is the bigger problem? She's like, this aggression. He's biting, he's hitting, he's doing this other stuff. I was like, we need to go to risperidone. Let's do risperidone. We'll do a little BID. We talked about the dosing. And I said, and then if you see an improvement in the aggression, but he's still really impulsive and hyper, and we need to add in a stimulant, here's how you do it. So what my goal of that is to sort of help her, teach her so that she can then say, okay, this is what I need to do to maintain the kid. And maybe still we're going to say down the road, we want psychiatry to see this kid. That's fine. But in that gap, you're helping us bridge what happens when that kid comes in. Okay. Or until we can get them in. Another call that I had, it was from one of the Santa Rosa PD residents, I think. They called and it was a neat one because they were like, we've got this girl, she came in, she's 15, she's depressed. We put her on sertraline. She's at 75 milligrams. She's doing much better, but she's still having some of this anxiety. She's still having some sad thoughts and some suicidal stuff. I'm like, why is she at 75? They're like, because I think that's as high as I can go. And I'm like, yeah, when you start metabolizing around 12, 13, your liver thinks it's an adult. I was like, so no, you push that dose because the average adult dose is 125, right? So what I do with my teenagers and my young adults, my starting, I get them up to 100. Okay. And then at 100, I say, how are you doing at the 100? Do we need to have you at 100 or 150? Does that make sense? So these are sometimes little things that are second nature to us that sometimes, even if it's just she was like, I really wanted to go up. And I'm like, oh, put her at 100. I was like, and then in 2 weeks, if things are even better, but still not great, I was like, I want great. I don't want to tolerate her being okay. I was like, so if she's tolerating it okay, let's get her to 150. So those are just kind of some of the questions we get. The one-time consults that we get, sometimes you guys are, if you're like, I don't know what's going on, can y'all take a look at it? The one-time consults are made so that you come in, they come in, we see them, we sort of do our kind of, here's our opinion, just like a consult. And then we send them back to you and we say, hey, here's what we recommend. I had one that somebody called me about, it was pediatrician. She was great, but she goes, this girl is 10 years old, just moved here from New Mexico, has a diagnosis of ADHD and is on lithium and Abilify. And I was like, what? And I was like, is there any bipolar? Is there any whatever? They're like, nope. The doc there just put her on lithium and Abilify, and mom kind of wants the meds renewed. And right, that just sounds weird, right? So that was one of those where I said, hey, can I see them? Are you okay if I do this one-time consult? I said, because something just doesn't seem right. We bring him in. One of my fellows saw the kid, no family history of bipolar, no family history of schizophrenia, nothing. The girl was diagnosed with ADHD, had never been on a stimulant or a non-stimulant for ADHD and was on those meds. And I was like, yeah, that's bad. Good thing you're here in Texas now. And we're not, I mean, I don't mean that to say anything about New Mexico, but I'm like, I'm glad that you're here so that we're able to have eyes on you. Put this girl on a stimulant. We started it and said we were just not just a one time, but we saw her a second visit, was doing amazing, sent her back, and we're probably never going to see that girl again. So there's a lot of them we can do those one-time consults, but we also had another one that came in that somebody called. It was a 14-year-old who was having intrusive thoughts of killing his family and friends. And it was very, I'm not going to go into it, but it's very graphic stuff that it was kind of like, we were like, something's not right. We need to get this kid in. So we want to take a look, and we bring the kid in, and it was sort of the beginning of his first break of schizophrenia. And so this was the kind of kid where I'm like, yeah, none of y'all should have to take care of that. That needs our eyes on it. This kid's really sick. So we've kept him in, and we've had to get him on just kind of the meds in the right way. So this, you see how the system is. What we want most of the time is that when you call us, I want to be able to explain things to you and teach you, and then say, you good? And you're going to say, yep, I'm good. We're going on. You may have one that's a difficult kid that you're like, I'm so invested with this family. I can't remember who, somebody called me once, and they were seeing, it was the kid of they had been the doctor for the parent, and then it was their kid. They're like, I am so invested in this family because I've seen them so long. They're like, they trust me, but I don't know where to go. And so they're like, I want to keep this kid. And I was like, a difficult kid. And I think they've called us like 3 to 4 times about the same kid. And we're like, yeah, that's fine, because we keep our records. We know what each person has said before and all that. So sometimes you're going to have ones like that where it's very complicated, but we're going to help you with it. Other times it's going to be, hey, bring him in because I think I need my eyes on him, and then I'll send it back to you. Or there's other times where I'm like, that's not fair to y'all to see some of the kind of really difficult ones that we see. Let's see. Oh, actually, you know what? We still have what? 10 minutes? So 1:30. Okay. Let me tell you something else. This is just, there'll be something a little separate from this. But with one of the consults we have, one of the things that I use a lot when somebody calls about ADHD, we had it was a resident, there was a PD resident who called one time and was asking about, what do you do with ADHD? How should I treat them? The kid's, not doing well with Ritalin. Should I just jump over to Adderall? So one of the things that we will do, we'll sometimes use some of our little clinical pearls and stuff that we have. And so the way that I explain to families, even my residents and fellows, when you're looking at stimulants, okay, I say they're like Coca-Cola and Pepsi. Okay, you have Pepsi is going to be your Adderall, your Vyvanse, right? You've got that kind of class. Your Coca-Cola products is going to be your Focalin, your methylphenidate, your Concerta, your, all these other ones, right? So all the things that are methylphenidate based. So what I tell people is I say, 70% of people are going to respond to either stimulant. So for you guys, just think about most people. There's probably a lot of y'all that are like, I'll drink Coke, I'll drink Pepsi. I really don't care. It's funny. I like Coca-Cola products. I do not like Pepsi products. I don't like the way they taste. Okay. So I could be one of those people who could respond to one of those groups and not the other. My wife likes Pepsi products. So everybody's a little different. So sometimes when somebody says, I've got a kid who comes in, they're responding to this medicine, but they're having a side effect. I mean, like the example that I use, like, it's like your Coca-Cola is too sweet for you. So I'm not going to jump from Coke to Pepsi. I'm just going to go from Coke to Diet Coke. Does that make sense? So if you're having a response in one class, stay within the class, don't jump ship on it. As opposed to if they're not responding to it and they're having side effects or something, then you may say, okay, maybe we need to shift over to the other one. So as soon as I use that Coke and Pepsi example for a lot of families, they go, oh my gosh, that makes sense. Now I understand why you're going to try within this class. Because I was like, you're responding, you're just having the side effects. Let me find the sweet spot. What's the one that you're going to want? Is it, Coke Zero? Is it, what's it going to be? So sometimes when y'all call us, we're going to say things like that you may even hear. And honestly, if we ever say things like that to y'all, steal it, take it, run with it, make it yours. We don't care. I mean, that's the beauty of us in academics, right? Okay, so now let's move on. Let's do T-Chat real quick. It's gonna be much shorter than CPAN because CPAN is sort of our main thing that we all do, but I just want y'all to be aware of T-Chat. What T-Chat is it's a program that we have that does basically telepsychiatry to kids in school. You think about the hardest thing sometimes for doing therapy for kids is getting them out of school, getting them to, the appointments, stuff like this. The school districts, we have things set up where the school will actually bring the kid into a room where there's a video thing, and they'll actually have therapy while they're at their school. So they barely miss any school. Parent doesn't always have to pick them up. We also do, I have 2 nurse practitioners that actually do medication visits. The medication visits we do for T-Chat are time limited. They're 6 months as a transition until we can move them on. But they can sometimes see the kids right there in school, get them assessed and stuff like that. And then we figure out where do they need to go for longer care after that. So basically, this is transferring access to mental health care for kids and families. So we do services through telemedicine. The thing about this, I've had people ask me before when I'm doing these presentations, and they say, how do I call and get my family set up in T-Chat? Well, you don't, okay? The school districts that are there, all you tell the family is you say, ask the counselor. They ask the counselor, that we have a whole referral process, they get them in. Most of what we do in T-Chat is therapy. It's not medication. We have, I don't know how many therapists. We have tons of therapists who see all these kids there. And so it's a wonderful, wonderful service. This 80 school districts that you see, we're actually past that already. That's just us here in San Antonio. Okay. That's not like statewide. I mean, this is us. As you look at all of these, we've got like tons of the surrounding area. We've got all the different school districts in there. As you see, covered lives, 247,000, 475 campuses. We cover a lot of area with that. And so then when we get the kids, if there's somebody who's going to need a longer term treatment, like if it's a kid who's having trouble in school and they're ADHD and they're just irritable and impulsive, and we just need to put them on a stimulant, when my nurse practitioners, they'll see it and then kind of get it managed, and then we'll send it back to you guys. If it's one of those where they're like, no, this is one we need to keep, then both of those 2 nurse practitioners of mine have clinics at Clarity, and we just then absorb them over into our clinic. So we kind of have a nice process for that. Short-term treatment, like we said, 4 to 6 sessions, which is usually for the therapy. That's usually around 3 months to 6 months. We usually go out 6 months for the most part. And then once completed, we do referrals. So that's T-Chat. ARPA, this is one of the other things I'm going to mention about. We have these intensive care. All this has been rapidly over the past year or 2 that we've been going. One of these is an adolescent substance abuse clinic. And that's sort of one of the big things that we've been doing. We're trying to kind of really get that moving. And it's really neat because, as you can imagine, substance abuse is a very tough thing. If somebody calls at Clarity in our UT Clarity clinic and says, I want to come for treatment of substance abuse, we usually don't pick that person up. Because the mental health needs, even though that's still a mental health need, the other mental health needs are so big, there are groups that alone. We take care of a lot of kids that have coexisting other mental health disorders and substance abuse, but we don't usually do primary substance abuse because there's some amazing places downtown that do that. But for this, we have this intensive care clinic. We have an adolescent substance abuse clinic. So that's where we will send people to that if it's solely substance abuse. School refusal is another thing. We have actually a clinic that we do where you get a lot of kids that have school refusal. And then the trauma is the other one right there, is that, there's just trauma is just so much right now. I mean, we see that with a lot of kids that come in that we have with the PTSD diagnosis. And so getting them set up, if they have sort of mainly just trauma, we get into some of these clinics and it's really focused. We also have a research arm of our thing where they're doing imaging and stuff like that as part of the, if people want to enroll from that trauma clinic. So we're going to see where that sort of takes us too. But these are 3 great intensive clinics. And if you want to get somebody in there, do y'all know how to do it? You call CPAN. It's that simple. Okay. I mean, we want to be sort of a one-stop shop where you call and you're like, I don't know where to go, or call and you say, I know exactly what I want. I want to be directed to this adolescent substance abuse. Whatever y'all want, we want to be there to kind of help y'all out with it. Okay. And then we've only got 1 or 2 more slides. This is our We Care therapy. We Care is wellness for children and adolescents, restorative empowerment. No cost mental health therapy service for children and adolescents, ages 3 to 20. We do in-person and we do virtual. We house this out of multiple places. We do some virtual, but we also house it out of the new building we have over on Eckert. One of the things that I really like about this, which is where we've been using it a lot when we send people from my UT Clarity clinic over there, is the second one down, parent-child interaction therapy. I had a mom of a kid that I was talking to this morning. He's a 4-year-old, had witnessed some very horrible traumatic stuff when his father passed away. And the mom has 3 kids. He's 4 and he's the oldest of 3. And so is kind of really trying and saying, I can do. But one of the things we said, she's like, well, I'm managing the 2 younger ones. So I just let him watch YouTube a lot. And we're like, well, you probably shouldn't do that. She's like, I don't know what else to do. And so we realized we're like, and as I mentioned to you, I think it was you that said earlier, I was like, you have to have driver's education and take a test to have a license, but you don't have to have kids. Right. And so, what we want to be able to do, though, is we want to be able to help people even after the fact. This mother really, really cares. She really wants to take care of those kids. And we're going to keep her in our clinic because they're a wonderful family. But I was like, you know what you need? You're going to need some parent-child training. And what that is they sometimes watch us as we're interacting with the kids, and then that's how they're going to learn. So the parent-child interaction training, it's a wonderful thing. We also have the trauma-focused cognitive behavioral therapy that you see in there. We're getting the EMDRs is kind of getting moving, but basically we just do a lot of support and stuff for the families. So you see, even though I'm talking about sort of the consortium and you've got MD up here, we're sort of like the smaller portion of it. It's the physician part of it. There's so many other resources that are there for your patients, and we just want to sort of be able to ones to help you access them whenever you need it. And you call, and we're one of those where if you call and we say, oh, I don't have the answer to that, we'll find it and we'll get back to you and stuff like that. So we all love what we do. We really do. Millie, yes.
Yeah, so just as the art or ran by teach us, so parents have to use all the art. You don't have to have the teaching all directly to the teach us.
And this, I'm not going to bore you with the quote. This is an awesome, I don't know if y'all know Maria. Does anybody know Maria? Maria's wonderful. She calls a lot. And it's so fun. When we get on the phone, she's like, how's your wife? And I'm like, good. How are you, Maria? So it's fun. Some of us who've been in here, the community a long time, we know each other when we call. So it's just a little quote by Maria. So, and then this is the last one. This is the 2 of them. The emails we have, very simple, CPAN, PeriPAN at UTESCA, each of them. You can go to there. Someone's manning those at all times. Honestly, the 2 of them are, if y'all need stuff, like even all this little swag and the fancy stuff that this is the stuff they bring. I joke that my wife's, she has a CPAN coffee mug at home that she uses all the time. And I was like, I don't even have one of those. How did you get one? She's like, well, they came to see me. So they've got lots of great stuff for you guys. If you ever need that, it's just kind of fun to have that. But the 2 of them have been wonderful and they do great outreach stuff. So if there's ever stuff that you need, they will, right, y'all go by, they can bring you stuff, resources, whatever you need. They're sort of, unless you're calling CPAN directly, they're sort of going to be your 2 contacts for all the outreach and stuff like that. So with that, I think that is it. So I want to leave a little bit of time for questions. What do we have? We got 6-7 minutes. Any questions? Anybody have any? Yes.
So I guess it's a 2-part question. Does this exist in other states? And if I'm assuming it doesn't exist in this capacity, do you guys have like a starter kit for how to get some of the CPAN stuff out of places? Because it sounds like an amazing.
Yeah, so it's an interesting thing. Where this originally created, I'm pretty sure it was Massachusetts was the first one. And so Massachusetts, they started this up there about 10 years ago. And well, I guess now it's been probably 13 years ago. It's been a long time. So they've been doing this up there for a long time and it worked very well. So when things all this started happening, they said children's mental health is important. And every bunch of states started looking at other places. So there's now a handful of states that are actually doing this. Not all of them. So yes, but this is one of those where when we wanted to set up our program, we did? We called it to Massachusetts and we're like, learn to model and stuff like that. So if you end up going to another state where you're going to practice and they don't have that, it's just a matter of you say, I knew these people back there. Like you call us, we'll get you in touch with Laura Williams, who's the head of this over at Baylor. Dr. Williams is wonderful, wonderful. We have ways that we can help you with that, but it is starting to become more. Do you know how many states it is? I don't know how many. I want to say it's like 5 or 6 or so, like very small. But I mean, fortunately for Texas, we had the resources to be able to create, they ended up in Massachusetts. So yeah. Okay. Anything else? I try to talk a lot during the thing so that y'all don't have any questions afterwards. So if nothing else, thank y'all for your time. And if you have any questions, please call us. So thank y'all.
Dr. Matthews. Hello.
Small token of thanks. Were you ever in the military?
I was not, but I have multiple ones of those.
Okay, so then you know that if you're in the
Yes.
military, you're part of the unit. So this actually signifies that you're now an honorary family physician.
Awesome.
Right.
Thank you. I am honored by that. So this is, so the just to add into that, the reason where I got one of my first ones is when we merged residencies with Wolford Hall, how there's a lot of the programs have merged residencies. Psychiatry was the first one to do it because they were going to talk about shutting down the base. So when we merged, it was the first day was July 1st of 1997. And the way I know that because I was the first civilian to rotate at Wolford Hall, showing up in my civilian clothes with all these people with M16s. That was my first experience in the military and I loved it so much. I went and did multiple rotations. And so that's why over the years I've gotten. So they're very much appreciated. So thank you. Thank you. Thank y'all.